Hi everyone, my name is Afiq. I'm the Senior Podiatrist at Alexandra Hospital. I'm here to answer some of your questions. Alright, the first question is, what should I look out for when buying shoes? When you are buying shoes, you need to look out for the 3F, okay? So first is the right fit, second is the right function, the third is the right fashion. The right fit is important because you need to have the right length when you're using it as well as the right width. Your longest toe needs to have a 1 finger spacing in front. For the right width, usually the width of the shoes as well as the length of the shoes, they are not proportionate. So if your feet is much more wider in front, you need to ask for extra width. Make sure that you use the appropriate shoes for the right occasion, whether you are working or doing some sports. The next question is, why is my feet smelly? There are many kind of bacteria on the bottom of your feet, okay? These bacteria actually live off the sweat that your feet are constantly producing. When they feed on the sweat, the bacteria creates an acid that causes foot odor. It could be because of poor hygiene, so you need to improve on your foot care and foot hygiene. So what are the tips to prevent this? When you're using covered shoes, please wear socks. Make sure that you change your socks daily and wash it separately in high temperature and a bit of bleach. Alternate your shoes often and dry them out in the sun. If your feet are quite sweaty, you can actually use a zinc oxide solution to actually place it on your feet before you wear your shoes. Do you treat ingrown toenail? As a podiatrist, yes, we do treat ingrown toenail, and it's actually a common complaint. It occurs when a small portion of the nail actually grows into the side of the toes. The patient can come back and see us every 3 months or 4 months to get the nail removed on a regular basis. For a long-term treatment plan, we can actually use a technique called phenolization. Alright, the next question is how to avoid cracked feet. Cracking skin usually occurs at the heels. Cracked heels may be unsightly, but they don't really cause much serious issue. So first of all, just make sure that you gently scrub your heels using a loofah or using a pumice stone to remove the thick, hard skin. You can actually apply a urea-based moisturizer to your feet, avoiding between your toes. And if you feel a bit uneasy, you can actually put on a pair of socks to keep the moisturizer in place. Alright, the next question is it true that flat feet will have high chances of getting back pain? How to overcome it? The term flat feet, refers to the lack of arch in your feet. You can actually born with it, whereby the arch doesn't develop as you grow. As you age, sometimes flat feet can occur as you get older. Usually the flat feet doesn't pose any serious problems. However, without any foot arch, the feet tend to roll inwards and cause overpronation, and of course placing stress on your ankle and knees, and this in turn causing problems for the hip and back. Thank you for the question that you asked. Hopefully I've answered them well. The feet is the foundation of your body. Taking care of it well means a lifetime of mobility as well as independence. Bye!